Hello everyone, and welcome back to MediInsights, your trusted channel for unraveling the mysteries of medications and healthcare. Today, we'll dive deep into everything you need to know about tetracycline tablets, from their uses and dosage to their mechanism of action, side effects, and crucial advice for safe use. Let's get started. Uses of tetracycline tablets. Tetracycline tablets are broad-spectrum antibiotics used to treat various bacterial infections. These include respiratory tract infections like bronchitis and pneumonia. They are also used for skin conditions such as acne and rosacea. Additionally, they can treat urinary tract infections, gastrointestinal infections caused by Helicobacter pylori, and Rickettsial infections like Rocky Mountain spotted fever. Tetracycline is also effective against sexually transmitted infections such as chlamydia and bacterial infections like cholera and anthrax. This antibiotic works against both gram-positive and gram-negative bacteria, making it a versatile option for treating infections. Next, dosage of tetracycline tablets. The dosage of tetracycline tablets depends on the condition being treated, the patient's age, and overall health. For adults and children over 12 years, the typical dose ranges from 250 to 500 milligrams every 6 to 12 hours. For children under 12 years, tetracycline is not recommended due to the risk of teeth discoloration and bone growth issues. For acne treatment, a lower dose such as 250 milligrams twice daily is often prescribed for long-term use. For severe infections, higher doses may be required under close medical supervision. Always take tetracycline as prescribed by your doctor and do not alter the dose or duration without consulting your healthcare provider. Next, mechanism of action of tetracycline tablets. Tetracycline works by inhibiting bacterial protein synthesis. It binds to the 30S ribosomal subunit in bacteria, which prevents the addition of amino acids to the growing peptide chain. This process halts bacterial growth and replication. Tetracycline's broad-spectrum activity ensures its effectiveness against a wide range of pathogens. Next, side effects of tetracycline tablets. While tetracycline is generally safe when used correctly, it may cause side effects in some individuals. Common side effects include nausea, vomiting, and diarrhea. Some people may experience loss of appetite or increased sensitivity to sunlight. Discoloration of teeth is a possible side effect, especially in children under 8 years of age. Other side effects include headaches, dizziness, skin rashes, or itching. In rare cases, severe allergic reactions or liver toxicity may occur. If you experience severe or unusual symptoms, stop taking the medication and seek medical attention immediately. Next, important advice for using tetracycline tablets. To use tetracycline safely and effectively, follow these important tips. Take it on an empty stomach, ideally 1 hour before or 2 hours after meals, for better absorption. Avoid dairy products, as calcium can interfere with the absorption of tetracycline. Drink a full glass of water with each dose to reduce the risk of throat irritation. Protect your skin by using sunscreen and wearing protective clothing to avoid photosensitivity reactions. Even if you start feeling better, complete the full prescribed course to prevent antibiotic resistance. Avoid using tetracycline during pregnancy or breastfeeding, as it may harm the baby. Lastly, inform your doctor about any other medications, supplements, or conditions to avoid potential interactions. By the end of this video, we hope you've gained a clear understanding of tetracycline tablets and their role in treating infections. If you found this video helpful, don't forget to like, share, and check the description for more details. See you next time on MediInsights, your guide to better health and wellness.